Good evening. I am Dr. Susmit Haldar, consultant dermatologist from Kolkata. Today I want to discuss about a problem which is prevalent for the last 2-3 years in India. That is the problem of ringworm infection, or so to say, it's a dermatophytic infection. It's a superficial skin infection. The problem which is very much rampant is that the patient suffering from this particular fungal infection is having a repeated infection or relapse, and that's why it becomes a frustrating state for the patient, and also it is a very challenging condition, challenging state for the dermatologist to treat and control the disease. It becomes a epidemic for 2-3 years back. We have seen quite a good number of patients among all the patients of skin diseases are with fungal infection. We treat with the medicines, modern medicines, but it relapses very fast. I'm not going in details for the causes for relapses, but few of the points which I want to highlight, especially for the patients for which it can relapse, for which it can perpetuate, the infection can perpetuate, and that I want to convey to the patients. First of all, patient should not use any medicine, be it topical, be it oral, without doctor's consultation. In our country, it is a very widespread practice to use medicines from the pharmacist or the pharmacy shop without consulting a doctor, and that gives a great problem, because most of the time they are using in this particular condition the cream, fungal cream, along mixed with topical corticosteroids, which is absolutely a no for treatment in this particular skin infection. So that is why the patient should stick to a consultant or a specialist advice without taking any treatment of their own. This self treatment is ultimately proves to be a detrimental. Number two, the patient should continue all the medicine that has been prescribed to him or her by a dermatologist for the specific period mentioned by the doctor. He or she should not stop the medicine in between, thinking that it becomes quite cured, or the lesions has already cleared, so no point of taking for 1 month of medicines or 1 month of applications. This premature stoppage of the treatment is usually lead to the continuation or perpetuation of the skin infection. Third, the patient should follow up the doctor according to the time advised by the doctor. Suppose the doctor has advised to follow up after 1 month, the patient should come after 1 month. This 1 month period, why the doctor is telling, there are certain reasons behind it. Sometimes the doctor wants to see whether there is really clinical cure after taking the medicines, or there is not that adequate cure for which the treatment may be prolonged further. So that particular assessment, the patient should give the scope to the doctor, so that they should come to the doctor after the stipulated period for follow-up. So far as personal hygiene is concerned, the most important thing is that patient should dry up their body, especially after bath, in the toilet, spending at least 10 to 15 minutes of time for drying up the whole body by a big dry towel. That time the patient should not hurry up to come out from the toilet, not completely drying up the body. There may be water, or there may be moisture in the body folds, and on that the patient can wear up the clothes, and that particular moisture of the water, as it not been dried up properly, can give rise to or perpetuate this particular fungal infection. So they should dry up the body completely. Then from toilet they should come to the room. The room doors and windows should be locked beforehand. Within the room, the patient will switch on the fan, stand completely naked underneath the fan, taking a fresh new dry towel. They should further dry up the body folds, then they should wear clothes. So they should use two separate towels, and these two towels, for the personal hygiene point of view, should be kept separate and should used only by the patients. This is a very important point. And another point, nowadays there is a trend of using jeans or very tight occlusive cloth. That is also not good for this particular skin infection, fungal infection, because that creates moisture, that makes the patient more sweaty, and that can give rise to the infection, can continue the infection further. So they should use some clothes which are loose, having a breathable fabrics, and they should change their undergarments regularly, right from the banyan, the vest, and the socks also. And number 6, there are rituals in many of the communities in India that they are using thread dhaga, or the threads along the wrist, along the arm, or along the waist. This particular thread made of suta, that means cotton, that should be avoided, because that can a potential source for water, and we know that this fungal infection thrives in getting moisture and water. So that has to be avoided. And this towel, what I have told, should be kept by the patients. And regarding the sexual relations between the husband and wife, any of them have any infection, they should refrain from sex till the disease is completely controlled. Otherwise there will be a ping pong infection between the husband and wife that will continue. So they should seek advice to the dermatologist to cure the problem, and then they can enjoy the sex. That is last point. And the last of all is that nursing mother, in case of nursing mother, the patient should be very careful to watch whether they have the patch on the nipples, on the breast. If they have, they should not feed their babies. They should go to the doctor's advice, and they have to cure it, and they have to feed afterwards. If the patches are not in the nipples or in the breast, the mother can feed the child, but mother cannot handle the child continuously. There should be some other lady to take care of the child. Mother will only come and give the feed. This is a very important point. Thank you very much.